Good afternoon, everybody, and welcome to today's weekly Wednesday webinar, our 5-minute brainstorm session covering this week Biden's plan for older Americans. President Biden's offered a plan to take on financial and healthcare related challenges for seniors, formerly known as the Plan for Older Americans. As we know, seniors are among the most vulnerable population in our country, and this plan addresses inequities based on age and income to help seniors better access quality, affordable health care and to make sure that we live up to our promise to them that they will live in a financially secure retirement. So here are 5 critical elements of the president's plan for older Americans and what they address. First, addressing prescription drug prices and using Medicare and its size and authority to negotiate with pharmaceutical companies for better, lower, favorable pricing. Right now, Medicare is not able to do that, and the Plan for Older Americans calls on Medicare to have that authority and begin negotiating for better prescription drug prices, and also to allow for the importation of lower priced drug alternatives coming in from other countries. So 2 critical areas around prescription drugs that can help bring down the very high costs that many seniors struggle with in this country every day. And then affordable health insurance. In this plan, there will not be any repeal or replace of the Affordable Care Act. You have to understand the ACA now has been in place for a decade, and it's become woven into the fabric of Medicare, Medicaid, and private insurance systems across this country. It's currently covering 23 million lower income Americans. And for Biden's approach, he will build on and find ways to improve the current ACA as opposed to scrapping it and trying to start over again from something from scratch. On Social Security and Medicare, bear in mind that Social Security covers 70 million Americans and Medicare covers 61 million Americans. The plan for older Americans will address the demographic issues that are threatening the long-term solvency of these programs. It's projected that out over a decade or more, the solvency of these programs, although currently well-funded, will continue to be challenged. So you can expect to see discussions of increased taxes, increased eligibility age and eligibility age bands, increased cost sharing for participants, but there will not be any move to decrease benefits in the process. The goal is to make it financially stable, but to not take benefits away from anybody who's on Social Security and Medicare, and in fact, even find ways to enhance benefits, such as Social Security's COLA increase for 2021 of 1.3%, and ways for Medicare to be providing even more services like negotiating for better drug prices or providing COVID-related testing, vaccines, and treatment for Medicare participants. Medicaid covers 75 million people in this country. And the Plan for Older Americans will seek to provide more incentives to the states to grow the federal-state partnerships to increase and provide coverage for those who are on Medicaid. Medicaid and the ACA will continue to evolve working together. They've sort of become a left-hand, right-hand approach to how more and more coverage is being provided to lower income and distressed Americans across this country. You can also expect more tax incentives to increase private pay approaches using things like long-term care insurance, life settlements, and savings programs to incentivize people to do more to prepare and be ready to handle their costs of long-term care, which Medicaid is the biggest payer of in this country as things move forward. And then with retirement savings, to do all we can through the plan to create more incentives and options for people to save in qualified vehicles like 401ks, address inequalities in tax incentives for lower income and older workers, so they have more reasons to be saving and investing as more and more people are working longer and older into their life. The more we can get people to keep working and saving into their older age, the more they're going to get out of their Social Security and Medicare benefits by having more money available to them to complement what they're receiving in their monthly payments from those programs. And I would say you should expect the fiduciary rules to be revisited by this administration. Those rules were the potential for changing and revising those rules were killed in the previous administration. In this administration, I think there's going to definitely be a taste for coming back to visiting and strengthening fiduciary rules, fiduciary obligations for advisors who work with clients, particularly seniors, in managing and growing their retirement savings and planning for the future. So I want to thank you for joining today's 5-minute brainstorm. And like we tell you, literally in 5 minutes, we're going to cover a topic that's relevant, it's timely. We want to give you information you can use, information you can think about, and we'll be following right up with you. Thanks for joining us. You're going to get an email with a copy of today's session, some materials you can look at. And as always, we continue to look forward to working with you to do all we can to help seniors and their families better plan for and control their retirement years with a variety of financial solutions, such as insurance products, life settlements, and everything else we can do to be helping our people in this country plan and prepare and have a very solid retirement and future. So thank you very much for your time today. We look forward to when we talk to you again soon.